Welcome to my podcast. Today I'm going to talk about another case station, which is basically loss of conscious. So basically, the patient will come to you after you introduce yourself and ask the patient name and date of birth. You will ask, how can I help you today? So the patient might say that I'm having a fainting attack. I collapsed the other day. So you'll ask the patient, can you tell me more about it? So the patient might say, I was standing or I was in a distressing situation whereby I felt blackout and I just regained conscious momentarily. So in that condition, it could fit with the blackout or vasovagal attack. Also, you will ask if the patient has been witnessed by anyone, and if, for instance, that loss of conscious lasted for some time. You will ask if the patient lost control of the urine or the poo, or if he bite his tongue, or if he injured himself by any way, by any means. And also, you will ask if the patient felt any increasing in the heart rate, or if he felt it was like irregular, so it could fit maybe with extra systole, or if the patient has, panic attack or psychogenic, so sometimes that could fit as well. And also you will ask if the patient has any non-medical condition, like for instance epilepsy or diabetes, so it could fit with diabetes if the patient experiences, for instance, excessive sweating and feeling weak and feeling fainting, so that could explain as well. And also, you will ask if there is any previous incident like that before. So the patient might say, oh yes, I have that happened quite a few times before. So from that, you will just try to understand that the patient's situation, and if there is anything that might be known in the history, or if it's a new thing. And also, you just need to ask about all of the risk factor which could lead to loss of conscious, and try to figure out if there is anything that can be spotted in taking the history. And after that, you will ask the patient if he had any thoughts or ideas, what might be the reason for that. Also, you will ask about his medication history. Maybe he's taking antihypertension. Maybe he exceeded, the dose, or maybe he's taking irregularly, so it could cause his low blood pressure, hypertension, and that's why he collapsed. So that's another thing. So always need to ask about the main ones, and if all of that has been inquired about, you will go for other causes. Also, apart from this, you will examine the patient, of course, and see the observation signs. So you're going to check his blood pressure, you're going to check his pulse rate, respiratory rate, and temperature. And also, if he had any recent, for instance, upper respiratory tract infection or flu, common cold, or he has any cough, and maybe has problem with swallowing as well. All of that could affect the patient alertness. And you will ask the patient if he completely, regained momentarily, after the loss of conscious, and what did he do after the attack. And you just need to see if the patient went for the A&E, for instance, or just being helped by the surrounding, or what he was doing when this happened. And did anyone notice or observed him at the moment of the syncope? Because sometimes patient might not be aware totally, what had happened. So you need to ask if the patient is aware about this thing, because sometimes they might have amnesia shortly after the attack. So basically, you just need to ask about all of that. As I mentioned, it could be vasovagal, could be blackout, could be postural hypotension, could be cardiogenic or cardiac reason, could be neurogenic, and in such a situation, when you ask the main ones that we are aware of, it could be unknown. And from that, you will just take it. So you might request, of course, after agreeing with the patient, for certain blood investigation. I forgot also to mention about asking if the patient has any problem with the balance and if they have any ear issue. So it could be another thing just to know about. Also, if the patient has any issue with their sight, or if they have any problem with headache as well, and ask if when he collapsed, did he felt any impending, whereby momentarily you feel dizzy and you can't hold yourself. Also ask about if he was doing excessive exercise or maybe postprandial. It could be another issue, whereby the food will cause vasodilatation and he might feel that he's about to collapse. So all of that you need to inquire about, and ask also if the patient is taking any medication on a regular basis, if he's taking any drugs, for instance, or alcohol excessively, and also about in certain situation, panic attack, whereby patient will hyperventilate. So this could cause too much get rid of carbon dioxide, and this will lead to the feeling of fainting and maybe collapse, coughing excessively, and also in certain situation maturation could cause that. So I just need to inquire about all of that, just to have a hint what's going on, and, and then you will take it from there. You will arrange for certain blood investigation, which is the routine, and also maybe you will arrange for ECG for the heart, and you will monitor for the oxygen level in the blood. And then you will, if the patient is talking to you and is feeling okay in himself, and just give him some warning sign and safety netting. If the patient is not feeling at any time, it's recurring, and maybe you tell the patient to put a diary, just to know if there is anything that been observed. It could be associated with this condition. So in order for the patient to know that, and also ask if there is any family member of the family who's well known with the chest condition, just in order to figure out if there is something that is missing, and ask about the lifestyle of the patient, if he's doing any sort of exercise, if he's following a healthy lifestyle. And by that, you should have covered the main points about those cases. And then, according to the patient reply, of course, you will direct your consultation. By that, I hope that I covered the main point of loss of conscious, and I see you in another podcast. Thank you.